Hello everybody. My name is Nina Stoyan-Rosenzweig, and I will be kind of overseeing, I'm not doing the actual presenting, the first session from a two-part talk by folks from the University of Florida. Dr. Sabo-Attwood will be presenting in session two, and three first-year medical students, Angelica Chalungari, Akanksha Dave, and Annika Liu will be presenting the first talk that is part of a project that has been developed with the assistance of a fellowship from the Harvard Macy Institute. So it looks like, and with that, I will turn it over to Angelica.
Okay, hi everyone. So again, as Dr. Nina mentioned, my name is Angelica. I'm a first year medical student here at UF. Sorry, okay. I think my other colleagues are here as well. But just to kind of start us off, so again, as Dr. Nina mentioned, in this presentation, we're kind of going to be exploring kind of the ideas of university art museums as healing natural spaces. And specifically, we're going to be kind of discussing a program that was created with this in mind. And so before I kind of delve into those ideas, I should first mention that this program was developed with the help of the Art Museum-based Health Professions Fellowship with the Harvard Macy Institute. So there's that. So what is this program? So essentially, what this program is it works to kind of use contact with art, especially, kind of the metaphorical nature that one can experience through art, to assist, students, medical students, health professional students, and, eventually patients with becoming kind of familiar with and comfortable with being in nature. And so in conjunction with the University of Florida's Samuel P. Harn Museum of Art, which is kind of depicted here, this project explores art museums and art as kind of like these neutral spaces for exploring sort of people's comfort, safety, and preference for further interaction with nature and other spaces. So you can go to the next slide. Okay, and so, again, as I mentioned, this project recognizes kind of nature as sort of this broad healing modality. And so I want to note particularly that within this project, we define nature very broadly. So we include, even small nature. So, like snails to larger organisms like, the hawk here, to even, habitats and possibly kind of wilderness areas. So nature is very broad with how we're defining it here. Okay, so, this idea of nature prescription programs, as kind of learned through all of these other presentations as well, is not new. For example, as I've listed kind of here, there are, websites such as ParkRx, where patients can kind of retrieve information about their local parks. There are programs like Walk with the Dog, where, physicians may lead, kind of group walks with their patients and therefore kind of create a safe environment for their patients who might be, uncomfortable in nature or fearful of nature. There has also been, rheumatologists, for example, also write prescriptions for their patients to, repot plants, which can be especially beneficial to patients that have arthritis or patients that might want to maintain kind of their motor skills. So that's a useful way of engaging in nature and also engaging in kind of that physical activity as well. Here at the University of Florida, we also have a horticultural therapy program where essentially patients with specific medical diagnoses can benefit from things like gardening or specific outdoor activities. And groups in general have also created kind of like these medical prescription pads where physicians or other healthcare professionals can prescribe different nature activities. Next slide.
Okay, so hi everyone, my name is Akanksha Dave. I'm also a first year medical student. So kind of going off of what Angelica was saying about nature prescription, here on this slide, you can see that we've provided kind of from the Shetland Islands, a program that shows part of a nature prescription. And so I don't know if you can, read the specific things on this slide, but essentially there are annual calendars that offer a choice of outdoor activities in specific areas. So things like, it's November right now, so things like according to the calendar, going otter watching or talking to a pony. Kinds of things like this could help patients be more in tune to what is available to them locally, and help make interacting with nature more accessible for them. Next slide. Okay, so this is an example of a calendar that offers seasonal outdoor activities in the Gainesville area, which is where we're located in the University of Florida. And so as, healthcare provider, talking through such a calendar with some of these activities can also help someone prescribe nature activities to their patient. And it can also, with the variety of activities, help the patient determine what kinds would be most beneficial or intriguing for them. So activities such as walking, something as simple as that, or even more interesting, such as birding or shell collecting, geocaching, kind of can help appeal to a wide variety of patients. Next slide, please. Okay, and so our question here is nature always inspiring, safe, and accessible? So because we know that contact with nature may not always be safe, accessible, or comfortable for all, sometimes some of us take it for granted that it is so accessible and inspiring, which is not the case for everyone. So some individuals, for example, may have grown up in urban areas and not had a chance to move comfortably and interact with nature. Or they may have like specific preferences for the kinds of nature, like preferring a beach environment versus a forest, because of like the experiences and the type of nature that they've had. Maybe they've grown up in an area that is often hit by like hurricanes. And so in that case, maybe an environment like a forest could be considered more threatening to them because there would be danger from things like fallen trees. And so there could also be like fears of specific animals that like live in those environments. Things like, spiders, snakes. Nature can seem violent if those predators are common, or nature can also feel unsafe if, the predators are large or potentially dangerous. And kind of going on to group experience. So particular groups, such as the Black, Indigenous, people of color, or BIPOC community, may have had and may continue to have negative experiences in outdoor areas. For example, some of those groups may have been excluded legally in the past. Let's say, for example, Jim Crow laws. Some of those groups may be made to feel, uncomfortable and face aggressions. And so they may feel physically threatened in certain outdoor areas. And so those groups that have those limited outdoor experiences obviously have not had the chance to develop comfort outside, and those stereotypes that kind of follow them limit the opportunities to experience the outdoors and develop those skills so they can become more comfortable outside. So outdoor areas also can be inaccessible in terms of distance and cost. So those are like economic reasons. Nearby outdoor areas also might not be safe, again, depending on the environment, although they may become safer if they are accessed in groups or with people who have higher skill levels. And finally, interests. So an individual's specific interests may mean that the local nature around them is not as enticing. For example, we live in Florida, so maybe rock climbing is not as possible in Florida. Or if you live somewhere it's landlocked, the ocean might be hundreds of miles away. Next slide, please.
Hi, I'm Annika. I'm a med student. So Akanksha brought up some issues regarding the accessibility of healing in nature. And as a solution, this project proposes using curated nature, such as gardens, especially in museums, that can offer opportunities for safe contact with nature. Next slide, please. So on the cover slide, Angelica introduced the Samuel P. Harn Museum of Art, which is UF's art museum, and it has a number of garden spaces, and it always has new and exciting resources. So in the next few slides, I will be showing works of art, whether from the Harn Museum, some are not, and I want you to think about how they make you feel and what images are most appealing to you. So many of these works of art in the new donated collection depict Florida nature and outdoor spaces. Some images might be recognized as safe and comfortable, while others, depending on the individual and their experiences, can be more challenging and uncomfortable. So this variety of perspectives can offer numerous opportunities. Next slide, please. So in some, nature once removed and metaphorical, or nature in art can be a means of accessing, of recognizing safe, nurturing, comfortable, and healing outdoor environments. Next slide. And so this project uses images of nature to allow individuals to explore how they feel about nature and natural areas to find what resonates with them. Next slide. And finally, this project explores ways of engaging with that metaphorical nature to help recognize and imagine entry into a healing space. Next slide, please. Yeah, so here's just some more works of art, and really think about how these make you feel, and also what are most appealing to you, and they can vary based on the individual, based on experiences, based on likes and dislikes. It's a lot of perspective and preference. Next slide, please. So earlier I discussed metaphorical nature, which is basically nature that's been removed from actual nature, and it's depicted in art, so you can avoid certain triggers that Akanksha's mentioned, certain dangerous animals or negative experiences. And once that's removed, we do have metaphorical nature, and thus it generates a safer space. It gives you a lot of variety in a museum. You have a range of choices, and within a museum or within general metaphorical nature, you also have the opportunity to explore images and spaces. Next slide, please.
Okay, so just to kind of cap it off, I know that we're kind of running a little bit low on time here, but essentially, again, we are kind of exploring this idea of using art museums as metaphorical nature and kind of engaging students, medical students, and especially patients eventually with that. And so when thinking about when I'm just going to go say really quickly, but these are kind of just like some opportunities that we've listed here for different art museum encounters. And so these are potential ways that we can kind of continue to engage students, patients in becoming comfortable with art. Okay. Thank you.
Yeah. Okay, so I just have about 5 minutes left here, so I'm gonna whiz through these slides, but I think I can get the idea across. So this is a picture I always like to start with, and I'm Sabo-Attwood, by the way, so I'm fairly new to this space. I'm actually the chair of the Department of Environmental and Global Health and run the wellness programs at University of Florida. but really got interested in this connection between nature and health and wellness a few years ago, and been really influenced by conversations with Don and Nina and others. So really pleased to be here. So this is the picture that I always start with because it makes me feel something for sure. And I'm probably biased because that's actually my daughter. But it always reminds me that if a 5-year-old can be in the moment and be inspired by nature, so can I. So I always start there. Next slide, please. So what I thought I would do today is just give you a little snippet of what's going on here at University of Florida with respect to green spaces and a prescription program that I've been involved with in the greater Gainesville community. So here's an aerial view of Shands Hospital. So we have a pretty big hospital here at Shands, and the outlined area there in white, the white outline, has actually been turned into a green space. Some people call it a healing garden for children. Next slide, please. And I don't have a lot of pictures for time, but essentially this is the design. And there's been a lot of people that have worked really hard on putting lots of different thoughtful spaces together there in conjunction with the horticultural folks and several others that were just mentioned, that is up and running and open. It's open to everybody, but it certainly has a focus on kids with the idea that children will be prescribed to use the garden as part of their healthcare plan in the hospital. And that's actually an initiative that got stalled by COVID, but it's picking back up starting in December of this year. So I was involved in a little bit of a different aspect on that project that I won't go into today. But when we got started in thinking about prescribing the use of green space to these children, we thought about, well, how could we sort of extend that behavior once they were not in the hospital any longer? And so we started looking at where the children were discharged to, and that's sort of the aerial map over on the right-hand side. And then how could we maybe do that? So next slide, please. So we got engaged with a program many of you probably know about, which is Kids in Parks and Track Trails. And essentially this is driven by Kids in Parks is the organization. And they help folks design self-led adventures. It's kid focused for sure, where it gets them outdoors. That's essentially the goal here. And they do that in a lot of different ways. And then there's a second level on that, which is they can actually be prescribed to use the trails as part of the program. Next slide, please. So the Kids in Parks has about 180 plus or minus a few track trails that are across the nation. You can see where a lot of them are clustered. We now have the first 3 in Florida that are here in Gainesville, which are fully operational now. We have a couple others that are going in South Florida now as well. Next slide, please. One of the neat aspects about track trails is they keep track of how many children are actually using the trails. And they do that because the methods are incentivized. So if they complete the little self-led adventures, which are through brochures, they can log in to a portal and then they get badges and other sorts of prizes for doing it. But at the same time, the company's actually collecting information about who's using the trail and when and so forth. So we set out to do this to incorporate a few other trails in the communities of Gainesville. Like I said, there's 3 of them. You can see sort of the questions that we wanted to ask. Can we take small doable steps to enhance existing parts in Gainesville as an inexpensive and enjoyable way for people to tap into the positive health effects of natural settings? Can we broaden how the public values parks to include seeing them as a public health asset, and can we impact health outcomes through sustained use of the trails? And so that's sort of a research piece that I'm interested in that I won't talk too much about today. Next slide. So again, going back to the where patients are live essentially, that are at Shands Hospital, we had a whole sort of framework for how we wanted to decide where the trails should be. And that was definitely one of the driving factors. But then, of course, we had to consider lots of other things like, you know, accessibility and so forth. And so that's what we did. Next slide. And so what's included in these trails are a trailhead sign, essentially, and then you can see below the brochures. And again, these are very focused on younger children. And so an adventure might be, you know, there's a hide and seek one where the kids have to sort of go through nature and, you know, observe and reflect and, you know, check off that they found something or answer a question about something. And so they're pretty neat and they're really tailored. So you work with kids in parks, so they're completely tailored to the setting and the flora and fauna or whatever else you're interested in that's particular to that area. So it was really fun working with Park and Recreation and horticulture folks and so forth to figure out how we should design these adventures. Next slide. And so I think just to wrap up here, because I'm at time, is, you know, thinking about campus RX programs, you know, could we use this sort of model to create some type of campus RX program, obviously for older individuals or to include older individuals. But could we then use this network in some way to expand their access to nature off campus as well? So sort of creating what I'm calling this community-based network. So the activity doesn't always have to be totally centralized on campus. So I'll stop there. I'm out of time, and thanks for the opportunity today.